Hello, this is Dr. Benjamin Colton. This is a clinical decision making course. Today we're going to talk about just the introduction to decision making, kind of just like what is decision making as a whole. And then as the course goes along, we're going to talk a lot more about like how does this apply specifically to our medical decision making, what type of errors and ways of or biases do we have, and how can we learn how to think better. This course is really needs to be have a practical component as well. Like I really wish I could get you guys in the hospital and walk with you through the different ways of making decisions. But at least we can talk about it some here, and then we'll have a lot of case examples that we'll walk through together. And then, and even I'll have some homework assignments for you guys that I want you to write down some things and send it in to me, just to so you can start practicing this idea of how do we make decisions well. Because just people in general do not make decisions well. Like they don't have a reason why they make decisions or a good method of making decisions, and so they just make a lot of mistakes. Doctors as well. So for office hours right now, you can email me or contact me through Microsoft Teams is fine as well. Um, for my emails on there. For lectures, they're all going to be recorded. They will always be there by Sunday, Tuesday, Thursday from by 8 a.m. And so you don't have to listen to the lecture right then. You can listen to the lectures mainly um, whenever you is convenient for you. And hopefully most of my lectures will be up well before those times, hopefully at least a week before a certain lecture you'd need to watch it. Hopefully it's already there. Um, so these are a couple different references and textbooks. Um, as part of this course, I'm going to have you listen to a few different podcasts. Um, and so this is the name of the podcast. It's called I Am Reasoning, Internal Medicine Reasoning. And I'm going to have you listen to a couple episodes of this specific podcast because it really, this podcast is pretty much on the topic of this exact course. We're going to have two different exams before the final. You can see the marks there. And then we're going to have a little bit of homework as well. And the homework is more so about participation. I want to see you guys trying out these tools that I'm going to teach you, and just trying to start applying them. So this lecture, this first one, is just going to be an introduction, some general principles about decision making and how to apply these to our daily lives. This is not specifically talking yet about medical decision making. It's just talking about decision making in general. So we're going to go through some different definitions and principles of decision making. We're going to talk about problem solving. We're going to talk about critical and reflective thinking, as well as how to make good judgments. So we're going to talk about just different situations where we make decisions, different types of decisions, and different parts of the decision-making process. And we're going to take those steps of the decision-making process and apply them to just practical problems, and also talk about different techniques that we can use in decision-making, and how we can apply that. So first thing is just how do you make decisions? So how do you make decisions on how to get to school? When you come to campus, how do you make that decision? Are you going to take a car or bus, or if you're driving, which direction do you go? How do you make those decisions? What about what to wear in the morning? Do you have a method on how you decide what you're going to wear? Do you just choose anything? What about who to marry? Do you leave that decision for your parents because that's a decision? Is your decision is I'm going to give that power to my parents, or do I say no? I'm going to make the decision based on the attractiveness of the person, based on how funny they are, based on how much money they have. Like how do you make the decision? Is it just feels right to you, and so then you decide to marry them? Um, and then what about how do doctors make decisions? Um, for doctors, a lot of times maybe it's similar. Like how does a doctor make a decision to start a medication? How does he make a decision what medication to give? So when we talk about different types of decisions, um, there's many, but a lot of them, there's decisions are so common. They're like every moment we're making a decision. Sometimes they're big decisions, sometimes they're small decisions, like where to go to medical school, a big decision, what shoes to wear today. Well, maybe that's a big decision for some people. My wife, sometimes I think that's a big decision for her because it really makes a difference. For me, I just choose the shoes that are closest to the door. Um, but some decisions are small. Some decisions are simple. Some are complex. Um, One thing, though, is that uh, there's a phrase, we say practice makes perfect. In this case, I don't think we're ever going to get perfect at making decisions, but we can at least get better. And why is that important? Why is that important that the more we practice making decisions, the better we can get at it? I think one thing is that it gives a reason for this course. Like the whole reason for this course is so that we can get better at making decisions. And hopefully that means we're going to become better doctors and we're going to become better decision makers just even outside of medicine, just in our lives, whether it's about deciding about ideas of um, faith in religion or deciding um, uh, uh, how many kids to have or who to marry. Um, just if we can have uh, practice learning how to make decisions, we can actually get better at it. Okay, first example. You and your friends are trying to decide what to do today. After much discussion, you decide to go to the movies. After the movie, you all sit down to discuss the idea of going to movies. And after a lot of discussion and a lot of debate and argument, you all decide that, you know, going to the movies, especially with a group of friends, it's a waste of time. This is what you decide. So when we're going over definitions, decision making is a complex process where you choose a particular course of action. Whereas a decision is the conclusion you reach after consideration. So, and then decision taking is the actual act of selecting from from the alternatives. And so, and then a judgment is a opinion or decision based on careful thought. And so, decision making is everything. And then you finally um, the decision taking is the last step of the decision making process, and the decision itself is whatever you have decided to do. A judgment is different than a decision in that a judgment is normally more based on like a careful thought out thing rather than a decision could be like well, let's go through this example again. So when we go through this example, the decision making process is like just in general the whole thing. You're trying to decide what to do today. You talk about it. You finally decide like, okay, we're gonna uh, um, go to the movies. The step of deciding to go to the movies, that's decision taking. So you took a decision, and then the decision itself is to go to the movies. So the decision taking was the act of deciding to go to the movies, and then the decision was going to the movies. And then a judgment would be more of like this end thing. Like you've really discussed this, like you've talked about the different good things about going to movies, the bad things about going to movies, and you finally decided that I'm going to make a judgment now. I'm going to decide that going to the movies is a waste of time. It's a little bit something bigger than just saying, I'm going to go to the movies. Like deciding that going to the movies is a waste of time is a bigger judgment. So there's different decision-making situations. A lot of our decisions are just our personal decision making, decisions that we make in our everyday lives. Um, um, it's just all day, every day, right? So it's a little bit different when we talk about clinical decision making. Clinical decision making is the process of we're gathering information, like we're getting information, we're interpreting that information, we're thinking about it, and we're evaluating all of that data in order to select an evidence-based choice of action, in order to really select the best choice of action. That's what we're trying to do in our medical clinics, in our clinical decision making. So for organizational decision making, we're talking about on a different level. Now we're talking about how to choose the best option to resolve a problem within an organization, or to to choose an option that's going to achieve the goal of an organization, like how many patients should we allow come into our clinic every day? How many doctors should we hire to staff this clinic? Things like that. There's routine decisions. So this is different situations where we can be making decisions. These are different types of decisions in general that we can make. One is routine decisions, and this is like the most common type of decision. Decisions it's really well defined and common. Um, there's established rules or policies that we can refer to help solve them, versus adaptive decisions, where that's decisions made when like the problem it's a little bit unusual and we don't understand it completely. And the last one would be an innovative decision um, that is made when problems are very unusual and very unclear, and really very creative solutions are necessary. So, like an example that I could think of for this is for a routine decision is like, okay, we have a Kia Picanto. Um, we want to build another Kia Picanto. And so there's already a manual on how to do this. People have done it before. We just need to make another one. So we just need to read the book, buy the parts, put it together the way that they tell us to. An adaptive decision would be like, okay, we want to make a new model of a Kia Picanto um, that has better gas mileage, that's more fuel efficient, that looks nicer. So we're going to take the Kia Picanto, but we're going to change it a little bit, if that makes sense. Um, so the problem is it's a little bit different than just building one. So we don't know exactly how to do it, but we have of something that we can use, and then we're going to adapt that to make it better. Whereas innovative decisions would be like, we want to do something completely different. We want to make a car that can fly. And so we'd have no idea how to do that. But so we're going to need some creative decisions. We have some information. We have cars, we have airplanes, but now we're trying to do something that's very, very different. Um, there's my example. So what about these? Like, where would you look at treating of influenza, like versus treating a person with a stroke that needs blood thinners, but they already have some mild GI bleeding? What about someone for treatment of COVID? So these really fall into those three categories as well. Treatment of influenza, it's very straightforward. Like, you're supposed to give an antiviral if they've had symptoms for less than 2 days. If not, then it's supportive care with like fluids and rest and eating a healthy diet. Uh, um, so this would be fall into the category of just a routine decision. There's an established rule that's in place for how we treat influenza versus a stroke in the presence of mild GI bleeding. Now, if it was just a stroke, it would be a routine decision because there's guidelines that we follow when someone has a stroke and needs blood thinners. But this person, we also know that if someone has GI bleeding, they should not be put on blood thinners. But now there's one reason the patient needs a blood thinner, but there's a reason the patient can't get a blood thinner. So what do we choose? So we have a lot of experience. There's a lot of patients that have this problem. And so a lot of times there's like not guidelines, but there's recommendations that, okay, if the GI bleeding is very bad, then we don't give it. If the GI bleeding is mild, we give it, but we give the blood thinners, but we just really watch them. And then if the bleeding gets too much, then we have to stop it. So that would go into the adaptive decision. We're taking these different rules and guidelines, but we're trying to adapt them to our situation. Now, innovative, I put that treatment for COVID. This is getting better. It's less innovative than it used to be, but especially a few months ago, like when COVID was just coming out, um, the the treatment, we didn't really know what the treatment was. There was different ideas about chloroquine or antiviral agents, different antibiotics. There was a lot of different ideas about it. But in general, like we didn't have any really good studies about it because it hasn't been around long enough. And really, still, like we don't have a lot of great studies, but it's getting better now. So hopefully, over time, the treatment of COVID will become a routine decision and not this kind of unknown um, thing where we need to have these creative ideas and make these innovative decisions about it. Okay, now we're going to talk about decision levels. And so, um, uh, first level, strategic decisions. So these are going to be like in a business made by top executives. They're talking about things that are about uh, how are we going to operate in general as a company, um, thinking about vision and ultimate goals for the company. Um, uh, Second level would be administrative decisions. This is made normally by middle managers that um, are going to resolve some problems that are a little more difficult for the lower managers, and just develop techniques in general to help the office function. And so put in some techniques to help the office function so that it can meet these long range goals that the top executives have come up with. Operational decisions, those are just the routine day-to-day events that are normally managed by kind of like lower managers. So an example, I think, in a business setting would be um, like like what kind of workplace um, what kind of workplace do we want to have? Do we want to have a place where people really feel comfortable? Do we want to have a workplace where people know they're going to get in trouble if they come to work late? They're going to get in trouble if they call in sick to work more than 7 days out of the year? Or just what kind of workplace do we want to have in general? That's an example of a strategic decision made by kind of like top executives. Um, uh, an administrative decision mainly is like, um, uh, okay, there's half of our people just got sick on the same day. What are we going to do to actually continue our company today and continue to serve our clients? Like, we can't shut down, we need to stay open, but half of our staff is gone today. And so, what are we going to do? So, this is not a normal day to day event, but it's still trying to find a way that we can solve the problem so that we can meet the goals of the top executives. And a day to day event would be like, you call in sick to your boss, and the boss says, okay, like, I'll write that down. Um, so there's already a policy in place for this. So it's just a day to day event. So those are the decision levels. Now we're going to talk about components of a decision, different parts of a decision. So one of the things is that called alternatives. These are actions that can be taken or not taken. And so even like um, not acting is a possible choice or a possible alternative. If I want to, I can choose to go to the store. I can choose to not go to the store. So the two alternatives is go to the store, don't go to the store. For a medical example, one would be like to treat a man has a localized prostate cancer. I can choose to 1, treat him with surgery, 2, treat him with radiation therapy, or 3, not treat him at all and just leave him untreated. Those are all alternatives. So states of the world are conditions that may or may not be present. So these things are relevant to the results of the decision, but it's not under the control of the decision maker. So I'll give you an example about that. A cancer, if someone has cancer, I don't know if for certain if it will respond to radiation therapy. So I don't know whether it already metastasized. I don't know whether the cancer will recur after the person or come back after the person gets radiation. So this is called a state of the world, like the cancer responding to radiation, the cancer metastasizing, the cancer coming back and recurring. All those are states of the world. So they're conditions that are important. It affects the result of the decision I make, but I can't control it. So an outcome is the result of a decision. And so, and this is, you could look at it mathematically as an alternative that is chosen. So you chose to do something. So I chose to go to the store, plus a state of the world. The store was closed. And so the outcome is I couldn't buy milk, and that's the outcome. So, in a medical example, would be a radiation is chosen for this patient that has localized prostate cancer. The state of the world is the cancer responded to the radiation. Like, I had no control over that. All I can do is choose radiation. But the state of the world is that the cancer actually did respond to it. So the outcome is the patient has increased life expectancy. Utility, that's I know that there's a lot of definitions in this first lecture, so there won't be as much later. Utility is the psychological or subjective value of an outcome. And when we're going through all these definitions, I don't want you to just memorize it. I want you to think about it. So then I don't care if you can say this exact sentence to me or not. I want you to understand what utility is. So an example of utility would be one outcome of radiation is nausea. So when people get radiation, they can sometimes get nausea. That's one possible outcome. But some people will find that outcome worse than others. Like, some people are going to feel like oh, this nausea is affecting my life so much. And other people will say, oh, that's not a big deal to me. Like some nausea, I'm just very happy that my cancer's going away. So it's the value that someone places on a particular outcome. So one person might say that the nausea, it's not a big deal. It's not very important. Someone else might say this is a very important bad outcome. So objectives is going to be the purpose or goal of a decision maker when making a decision. Like what is the decision maker hoping to get out of making this decision or doing this act? So an example, a patient that wants to live as long as possible. So that's my question for you, I guess, is what would be the objectives um, in a patient in with these two patients? So a patient that wants to live as long as possible versus a patient not wanting to spend the last part of his life in a hospital. So if the main objective of a patient is that he wants to live as long as possible, maybe he's more willing to take chemotherapy or radiation or whatever, and even if it makes him sick. Um, but a patient that just does not want to spend the last part of his life in a hospital might be less likely to accept chemotherapy and radiation. So really, it's very important. Like the objective of the decision maker or their goal or their purpose, it really changes the um, their. It can really affect their how they make their decision in the decision they end up taking. Okay, so these were different components of a decision, some different definitions. Now we're going to talk again about some different decision situations. And we're talking in these situations about how much we know about the decision that we're taking and the possible outcome that it will have. So, one is a decision made under certainty, and that means the states of the world are known. So, we know uh, we know these states of the world. We know whether the cancer will respond to radiation, or we know whether it has metastasized, or we know whether it will recur. So if we already know that, then then we'll make a decision based off this information that we know. So if we know the states of the world, it's very easy to determine the outcome because it means that, so if we know that the cancer will respond to radiation, um, that's the outcome. Like, so if we choose one alternative, treat the person with radiation, we know the outcome or the state of the world is that the cancer will go away. We know if we don't choose, if we don't give the person radiation, we know that the cancer will not go away. So it's a little harder. So that part's easy. It's a little harder when deciding what the utility or values of those outcomes are. So for someone that, let's give an example again. Um, so if we know that uh, every time we give radiation, a patient will get nauseous, and every time we don't give radiation, the patient will not become nauseous. Okay, we've identified the outcomes, but like we said, we don't know how much the patient will. We don't know the utility or values of those outcomes because we don't know how much the person hates nausea, or we don't know if nausea is not a big deal to them. The hardest thing is to how do we resolve the trade-offs when one alternative better achieves objective A and another alternative better achieves objective B. So this is like the idea is sometimes there's two problems. So say this exact case, the patient has cancer. So one of their objectives is to get rid of their cancer. Another objective at the same time from the same problem is that they don't want to feel sick all the time. And so, but we know, so one alternative is giving them radiation that's going to help the cancer, but maybe not giving radiation or not giving them radiation as frequently will help them not feel so sick, like help them not feel so nauseous right away. So it's hard to decide, well, which one is more important. Um, okay, the next situation is a decision made when there's risk involved. And that's where we don't know the states of the world, where they're unknown, but their probabilities are known. And so this makes it so that all the problems under uncertainty, like all of these, determining the outcomes, deciding what value those outcomes have, and deciding how to resolve the trade-offs, we have all those same problems, but they're even more difficult. So for example, if we know that the cancer will respond to radiation therapy, or so we don't know if the cancer will respond to radiation therapy. So the state of the world is unknown, but we do know the probability of one of the states of the world. And so, like, we know that in 45% of patients with cancer, of this type of cancer, it does respond. Or, and then in maybe if we don't do radiation therapy, we just do chemotherapy instead, we know that the cancer responds in 25% of the patients. And so we don't know for sure what will happen if the cancer will respond or not. So the state of the world is unknown, but the probability um, of a certain state of the world happening, of the response of the chemotherapy or something like that, um, we do know that. The last one, or actually there's two more, but this is the main last one, is a decision made that is uncertain, like or made under uncertainty. And that's where the states of the world are unknown and even their probabilities are unknown. And so these problems become even more difficult to answer. Like all these problems, determining the outcome, determining the utilities, determining the trade-offs, it's even more complicated. Like uh, like really virtually impossible to know for sure, which is why it's an uncertain decision. Um, like uncertain decisions, for an example, would be there's a treatment um, for a certain disease, but there hasn't been any clinical trials done for that treatment yet. It's just a like maybe so if someone's so desperate to get treatment for their cancer, all the treatments have failed, so they enroll in a study where doctors are studying a new medicine to see whether it will work or not. So that's an example of an uncertain situation. The last one here is conflict, and that's where the states of the world include other people's choices, where their choices may depend on your choices or even their beliefs about your choices. So I'll give you an example, but just in general, we have all the problems of decision under uncertainty, plus we have to start thinking about our strategy of how we implement the decision. Like we need to start thinking about how to respond to someone else's actions or how to influence someone else's actions. For example, uh, if I prescribe insulin for diabetes, um, I in this specific patient, like I don't know whether uh, it will decrease or whether it will increase their life expectancy. Um, and I don't even know, will the patient even take the medicine every day or not? Um, and so now I'm starting to have to think of uh, like if the patient doesn't if if the patient's life expectancy depends not only on the insulin, but on her taking the insulin, um, then this decision is made under conflict because now I have to start thinking about how do I encourage her or influence her, this patient, to actually take the medicine. Um, so the state of the world includes other people's choices. So her choice to take the medicine or not take the medicine is going to have a direct impact on whether her diabetes is going to improve and whether her life expectancy is going to increase or not. So this is a different way to look at it. Um, uh, the decision maker faces condition of certain certainty, risk, and uncertainty. And the levels of ambiguity, or the levels of really not knowing, and the chances of making a bad decision get higher as we move up this line. So we could make a bad decision, but we have a lot of information here, so we're less likely to make a bad decision. Here, okay, we don't know everything, and here it's like, man, we just don't know a lot of things, so the likelihood of us making a bad decision is much higher. And if you want to look at how to decide what in a flowchart is a decision made under certainty, uncertainty, or risky, you can ask these questions. Are multiple possible outcomes possible at the same time the decision's made? So if, let's see, if I give someone insulin in the hospital, I know that their blood sugar will go down. So, no, there's not multiple possible outcomes at the time the decision's made. So the decision is certain. I know that the blood sugar will go down when I give her insulin in the hospital. I'm looking at it, I'm giving it myself. There we go. Um, is there, but a lot of times there's multiple possible outcomes. So if I decide to write an order for insulin um, at the hospital and then a nurse, and I'm expecting a nurse to give it, are the possibilities of these multiple outcomes known at the time the decision's made? Do I know how likely it is that the nurse will give the medicine? Um, Maybe I know that in my hospital um, uh, there's um, a 99% chance that, or there's a 1% chance that I write something down, the nurse doesn't give it. Maybe there's a study that's done on it or something like that. If that's the case, then yeah, I know the possibility of the outcomes. So then it's risky. But if I have no idea what the likelihood of the nurse giving the insulin is, then it's no, and the decision is uncertain. And so if it's uncertain, has a higher likelihood of the decision, it being a bad decision. So some examples I have for you. You tell me. Uh, there's what one thing that we've been doing recently in Jordan is allowing people to end the quarantine in their quarantine at hotels, like people that are coming back to Jordan. They go in a hotel for 14 days, and then we allow them to end that quarantine. Even though we know that some people have been infected with coronavirus but haven't shown any symptoms for up to 21 days. So, is this a decision made under certainty, risky, or uncertainty? So this one would be risky. The reason why it's risky is that there is a risk. I'm not saying it's right or wrong, but we just know that there is some risk that some people will still not be shown, will have coronavirus, but not be showing signs of coronavirus for 21 days. But we're still letting them out of the hotels after 14 days. So there is some risk involved in doing that. Another example, um, giving chloroquine to patients with COVID um, when, before there are any good clinical trials to assess the risk and benefits of the treatment. So that's what some hospitals have been doing. Some hospitals have been giving chloroquine to patients with COVID, but there aren't any good clinical trials to assess the risks and benefits of that treatment. This is actually how it was before, but now we're actually doing it less because there are more good trials and they're kind of showing that maybe there are more risks involved. Um, so this one is a risk done under uncertainty because there's no good evidence. Like we really don't know. Like um, if um, if we knew that um, 75% of patients respond to chloroquine, then it would be risky because we're giving it. There's possible risks, but there's 25%, there's 75% chance that it's going to be good. So maybe we choose it. But this one is uncertain. And so there's a higher risk of this being a bad decision, which it's kind of turned out that it's true. Like it was probably a bad decision for, it's not saying that it was wrong. People were doing the best they could at the time, but there was a higher risk of it being a bad decision because we just didn't have any information about it. Whereas with this one, uh, there's um, we know that there's a risk, but we know that the risk is pretty low, and so that makes it less likely that this is going to end up being a bad decision. Okay, so these are different ways that people study decision making. Um, one type is called the normative approach, and that's how should we make decisions? Like that's the question of the researchers. How should we make decisions? Should we make them critically or intuitively or something like that? So we'd use science and research and statistical information, um, and then we decide this is how we should make this particular decision. Like we decide that we should give someone um, uh, with a like what's a good example? Like for everyone with COVID, they should be quarantined for 10 days after the onset of their symptoms. We've done research. We see that people are not contagious if they've shown symptoms. Um, if it's 10 days since they started showing symptoms, we have seen by studying it that they're not contagious anymore. So we are deciding that um, they don't need to isolate themselves anymore. So that's like the normative approach. Descriptive approach is we're asking the question, how do people make decisions? Like in general, do people make it intuitively um, or just how are they making it? Do they have like biases involved? Are they thinking illogically? Um, so it's more of like how are people making decisions, not how should we do this decision, this particular decision right here. Prescriptive approach is more the question, how can we help people make better decisions? Um, so and we're going to talk about all these three in general throughout this course. So when we think about a good decision, I mean, what would you guys say? What's a good decision if you feel like coming to Hashemite University for medical school was a good decision? Why do you think it was a good decision? Um, uh, One of the things that we can look back on, like how did we make a good decision, is did we consider the positive and negatives of all the different alternatives. Like, did we consider the good things and the bad things about going to University of Jordan versus going to a medical school in Romania versus going to Hashemite University? Um, Also, a good decision. It considered all the different outcomes before, and so like, okay, I know, like, so before I decided to go to Hashemite University, did I consider that this is going to be further away from my house than a different university, or did I consider that I will be able to work at Prince Hamza Hospital and it will be easier for me to get a job afterwards? Did you consider the outcomes? Did I consider the objectives and values of the decision makers? And so, um, did I think about what do I want to do by going to medical school? Okay, my purpose of going to medical school is so that I can end up working at Prince Hamza Hospital. Well, okay, like Hashemite University has a relationship with Prince Hamza Hospital, so this is going to help me, this decision. Or did I not even think about that when I was making the decision? Um, it uses all available relevant information, and so if uh, we should just try to do as much research as possible. Like, did I research all the different universities and take that into my decision? Um, and then decision makers are not afraid to revise a decision if the circumstances change. Like, what if I, I chose to come here, but then my mother gets sick and she lives near University of Jordan, and it's better for me to live closer to her. It's is my decision. Am I open to changing my decision um, based on that new information? That would make it a better decision. Uh, Anticipates questions and outcomes. So if we're thinking about what problems might come up, or if we're anticipating what might happen based on the decision, um, then it's a better decision. Like, did I anticipate that I'm going to have to drive in for 1 hour each way to get to Hashemite University? If I anticipate it, then I can start asking the question, well, how can I um, uh, help solve that problem as much as I can? Like, um, do I drive with someone else? Is there a way that I can take that there's less traffic, something like that? And then also the last thing is that the decision makers keep notes and other information for reference. So then when I go back and think about, did I make the right decision, I can go back and refer to the the decision making process. So this is the decision making process. We define the problem, we gather the information, we develop all the alternatives, we weigh the alternatives, like we compare them, which one is better, which one is worse. We select the best one, we we choose it, and we implement the solution, and then we monitor the progress. So we're going to talk about each one of those. Um, this is a big chart, but the main idea is like when we're a lot of times, even if we think about this with a patient, we're first defining the problem. So the first thing is the patient has a cough. Okay, so the patient has a cough. We're going to get as much information about that cough as possible in the history and the physical. And then we're going to develop all the different alternatives, like our differential diagnosis for why this patient has a cough. Is it asthma? Is it COPD? Is it a viral illness? And then we're going to weigh the alternatives. We're going to say which one is more likely in this patient based on the history, based on the exam, based on the labs. And we're going to select the most likely one. So this patient, okay, I think most likely they have asthma. We're going to implement the solution. I'm going to give her an inhaler, and then we're going to watch her, have her come back. Did it get better, or did it get worse? Did it not stay the same? If it didn't get better, or even if it did get better, we can learn from it. We can say, okay, yeah, I thought about that right. Or no, I didn't think about that right. This person actually had a different problem. So problem solving, we're going to compare problem solving and decision making, but first we'll talk about problem solving. So a problem is a current unsatisfactory state that needs to be changed to a desired state as soon as possible. So it's something that's not good that needs to become better, or a state that is not complete that needs to be completed. Problem solving is the whole process that it starts with a problem and ends with a solution. And so, but there's always a decision-making step um, is a part of that problem. So we'll compare the two here. So decision-making versus problem solving. They're similar, but they're not exactly the same. But sometimes they do kind of depend on one another. So, for example, a decision making, it may or may not involve a problem. Like getting dressed, it's not really a problem. You just need to get dressed. Um, but you do have to select from different alternatives, unless you only have one pair of clothes. But I think most of you probably have more than one. Um, so you have to make a decision. What clothes do I want to wear? But you're not really like, it's not a problem. It's just you have to decide. So in problem solving, it involves really diagnosing a problem and solving it. And so, and there may actually be more than one correct solution. So a lot of times in medicine, we're trying to decide like, okay, this person has asthma. Should I give uh, um, this inhaler or this inhaler? They might both be correct, but the whole process of diagnosing the person with asthma and then giving them treatment, that whole part is problem solving. But within that, you're making a decision. So really, decision making is a subset of problem solving. So you have this problem, you wanted to solve the whole thing, but as part of solving that problem, you need to make some decisions. When we talk about problem solving methods, there are a couple to note. There's more than this, but one is the trial and error method. If you haven't heard of it, it's where you have a problem, you have all these different possibilities to solve the problem, and you just try one solution after the next. So if you're trying to, someone has wheezing, and you could either give them an inhaler or antibiotics or steroids. Um, you just give them the inhaler. If they get better, good. If not, you try something else. You try something else. You try something else. Um, uh, um, Another idea is experimentation, where it's a little more scientific, where we come up with a hypothesis or a theory, and we're testing that to enhance knowledge and understanding. And so rather than just trying randomly anything, we have a specific hypothesis that we want to test, and then we test that, and then we study that to help us know, is this a good decision? Should we do this from now on? Um, and helping with our knowledge and understanding in general. So when we're talking about problem solving, there's some different steps. One first thing, and these might look very similar to decision-making steps, and in fact they are. So we define the problem. This is in the when we're assessing a patient and diagnosing them. We're gathering and analyzing the information with our history. We generate all our alternatives and selecting an action, and then we implement the action, and then we evaluate it. So this is pretty similar here for problem solving, this list, and decision making. So you don't have to really worry about that. The process is different. Just knowing that the decision making is really a subset of problem solving. That's the key thing. Um, so number one, define the problem. It's really difficult to solve a problem if you don't know what the problem is. Sometimes a problem can be really simple, and sometimes it can be really complex. So if someone patient comes in and says they have a cough, okay, that's the problem. That's a simple problem. If the problem is uh, um, I want to um, make Jordanians more healthy, so I know what I want to do, but I actually don't know what the problem is, I'm not going to be able to fix it, you know? So I have to figure out what the problem is so that I can solve the problem, you know? Um, so, um, um, and so maybe there's a lot of problems that make up a problem. So it can get really, really complex. So one of the things that you can do when you're defining a problem is do something called making an affinity map. And so where we're organizing different ideas into a common relationship. So this example here is this business is having a hard time implementing a continuous process improvement. And so they're trying to um, start a way of improving the way they do business in general, um, but uh, they're having a hard time doing that. So they decide to like break it down by groups. So maybe they write out all these different things. Okay, there's so much pressure for success at our business. That's stopping the us from getting better and better because we're not. There's just so much pressure. Some of it is that there's short-term planning, and so people aren't thinking about the big picture. Sometimes people are trying to do too many projects at one time. Sometimes people aren't being giving themselves enough time to do something. um, Sometimes people don't know what the customer wants. That's making it so we can't improve at this business. And so what they're going to do is they're going to write all these things down, and then they're going to group them into different groups. And so all of these are like old ways that managers uh, they call it old management culture, like a type of management that they don't want to have anymore. And so they put them, all of them are here. And then there's some of them that fall under the line of lack of planning. And so when they look at all these different things, they say, you know, these are all really under the idea of lack of planning. So then they have defined the problems. And so they actually have like 5 different problems here. And so the main idea is that they want to get better as a company. And now they have 5 different problems that they can specifically work on. Um, and so now they can go on to the next step. But at least they know what their problems are. They have an old management culture. They have old ways of thinking. They have some organizational problems they need to solve. They need better planning, and they have a lack of uh, time and quality management. Um, and so they're going to work on that now because and maybe the one that has the biggest number of problems, they could try to work on that first. There's another diagram that you can use. It's called the root cause diagram. And so there's a team that gets together. There's a problem in a some equipment at a mechanical engineering firm, and they write down all these different problems, but then they realize, you know, like this problem here is actually caused by this problem here. This problem here is caused by this problem over here, which is caused by these problems. And so really, as they go back and look, they say, really, if we fix this problem, it's going to fix all these other problems. So we don't want to just focus on fixing this problem. We want to fix on the root cause problem, like the problem that's really at the bottom of everything. So after we've defined the problem, we really know what the problem is, then we can gather information about it. So we can collect data, we can do research, like in our medical terms, we would be taking a history, we would be doing a physical exam, we can be doing reading about a problem, things like that. Um, these are some different questions we can ask, like when we're gathering data, what's the setting? And so if a person is having asthma or wheezing, they come in and say they're having wheezing. What's the setting? When are they having the problem? What is the problem? They're having shortness of breath. Where is it a problem at? When is it a problem? Who is affected? Is it just the patient? Is it a whole family? Is it a whole society? Um, is this a problem uh, like in a company? Is this your problem, or is this someone else's problem that they should be solving and it's not your problem? Like uh, if you have a spouse and they have a lot of anger problems, is that something you need to work on, or is that something your spouse needs to work on? Because you're not going to be able to solve someone else's problem for them. Um, so, what's happening? Why is it happening? You don't need to have all these questions, but these are just some ideas that you could ask while you're trying to gather as much information as possible. And then we want to define our objectives clearly, because without a clear objective, a poor quality decision is really likely. And so, in one problem, might need more than one objective. So, like increased life expectancy, these are examples of a certain objective. So, if we just want to help someone get better, that's a very big objective. What does that mean that you want them to get better? Do you mean you want their patients their symptoms to decrease 50%? Do you want their symptoms to go away completely? Do you want to reduce their pain? Do you want to be able to see patients more quickly in your practice? Do you want to help the patient feel more satisfied with the visit? Do you want to increase their life expectancy? It's better to have these very specific objectives, because then it's much easier to make a decision, come up with alternatives, and pick the best decision that's really going to help. So next, we're going to generate a lot of alternatives. We call this brainstorming. In brainstorming, you're just going to write down as many ideas as you have. This could be ideas on way to solve a problem, like treatment options. It could be on, if you're just looking for a diagnosis, you could write down all the different possible diagnoses. And really the main thing at this point is don't limit yourself. Just write down anything or think or say anything that you need. And this is great like in a group, because you can get even more ideas during this time. And the idea that it's just no idea at this point is crazy or stupid. You want to get all the ideas out there, and then you can choose the best one after that. So after that, you're going to evaluate the alternatives. So that's why you don't have to worry about if an idea sounds crazy or stupid at this point. Because after this, you're going to evaluate it. You're going to think about each alternative and say what's good about it, what's not good about it. List them all out. And there are some different methods there's a lot of different methods on how to evaluate each alternative. We're going to talk about a couple of them here. One is this Thomas Seites analytical hierarchy matrix. We're going to list the alternatives in columns and rows. We'll show you the matrix after this. It'll make more sense. Starting with alternative A, go across the columns and rate each alternative against the others. If the alternative has more value than if one alternative has more value than another alternative, then you give the more valuable one a score of 1. When the alternative has less than another alternative, then you give that alternative a score of 0. And then you add the highest score, add the score for each row, and the highest score is the highest rated alternative. So let's look at this here. So we have alternative A, B, C, D. So, and then we write A, B, C, D here as well. So here, there's a line down here because we're not going to compare alternative A to alternative A. So we're going to compare alternative A to alternative B. And here we're going to say B is a better alternative to A, so we're going to give A a score of 0. Now we compare alternative C to alternative A, and we decide, alternative C is better than alternative A. We're going to give it a 0. Same thing. Alternative D is better than alternative A. It gets a 0. Now next row. We're going to compare alternative B to all of these. When we compare alternative B to alternative A, we think, alternative A is better, so it gets a 1. We'll skip this one. And then now we look at this. Alternative C, no, that's worse than alternative B. Um, uh, Sorry. So here we're saying alternative B is better than A. Alternative B is worse than C, so it gets a 0. And then alternative B is better than D, so it gets a 1. Did I say that wrong for alternative A here? So for alternative A is worse than B, so alternative A gets a 0. We're looking like at the rows here. Alternative A is worse than C, so we're giving alternative A a 0. Alternative A is worse than D, so it gets a 0. Now skipping down to C, alternative C is better than A, so it gets a 1. Alternative C is better than B, so it gets a 1. And alternative C is better than D, so it gets a 1. Alternative D is better than A, so we get a 1. Alternative D is worse than B and worse than C, so it gets a 0. So then we add all these up in rows, and we see that alternative C has the highest score. So in this matrix, it's the highest rated alternative. There's another matrix that you can do. It's called the suitability, feasibility, and flexibility matrix. So for suitability, the question is really, is this alternative ethical? Is it practical? Is it appropriate in scale or importance? Is it too extreme? Is it not extreme enough? Like how much does this huwa munasib wala la? That's really the question. Feasibility is, do we have enough resources to solve the problem? Is it affordable? Is there enough equipment available? Do we have enough staff? And how likely will it actually solve the problem? Flexibility is, does the alternative leave open the ability to respond to unintended consequences? So once I've started, is it easy to go back and choose a different option? Or once I've made this choice and started to implement the choice, is there no going back? And also, can you control any of the outcomes once you begin? Or once you begin, you can't control any of the outcomes anymore. And then you total the score for each one. So we'll do an example as well. So this is the matrix. So we'll say for alternative A, you can give it any score you want, say 0 to 5. Alternative A, we might give it, it suits, it has good suitability, so it's a 5, and then feasibility, it's not really feasible because we don't have enough money, that's a 3. Flexibility, it is very flexible, so we give it a 5. And then we add up the score, and we just do that for each alternative. We'll go through some examples in a little bit. So choosing the best alternative and acting decisively. So we finally, at some point, we have to choose a decision, and it's better to act decisively. And really not acting, that is an action. Like if we're going to give a patient one medication or a different medication or a different medication or no medication, that's still a decision. So when I bought a car, I started, after I bought the car, I started still looking at prices for other cars that I could have bought. And I realized this is not acting decisively. Like, once I buy a car, there's no going back. So there's no reason to look for other cars because it's just going to make me sad if I found a different car that's a better price. And so really, when we choose a decision, we need to do it 100%. Like, don't give someone antibiotics for 2 days or for 10 days and then decide after 1 day, like, oh, maybe it's not good, or don't decide to just give them half the dose of antibiotics. Like, you have to, if you think someone has a bacterial infection and they need antibiotics for the bacteria, give them the whole dose of antibiotics. If you don't think they have a bacteria, don't give them the antibiotics. Evaluating. So lastly, we want to evaluate. We want to, if it's in the medical setting, maybe we want to see the patient back. If we put in a new system in one of our clinics, we want to evaluate, is this um, decision, is this new thing helping us do what we want to do? We can also get feedback from others about it and just be monitoring the results in general. Okay, now we're going to go through an example altogether. So the problem that we're saying is that Bedouin people in Jordan living in rural areas have a hard time accessing doctors. So that's the problem. So next step, we're going to gather information, right? That's step number 2. So we got to do some research. We got to figure out how many people live in these areas, how many doctors are there, and how do the people living there, how do they currently access care? And what are the barriers to them receiving care? Like we might need to talk to them. We might need to talk to the Ministry of Health. We might need to talk to the local population, the local Bedouins there. We might need to talk to the local doctors. So we're going to gather all this information. So now we're going to define the objectives. So there's a problem that they're having a hard time accessing doctors. But what specifically do we want to do? What's our objective? Do we want them to be able to have more access to surgeries? Do we want them to have more access to primary care doctors? Do we want them to um, their whole their life expectancy to increase? So for right now, we're going to say we want to increase access to primary health care for Bedouins living in rural areas, meaning we want to make it easier for them to see a primary care doctor. So alternatives, these are some of my alternatives, and maybe you have some others. We could pay doctors that are working in rural areas more money. And so maybe more doctors would go work there because they can get more money if they work there. Alternative B, we can provide free transportations to rural Bedouins. Like maybe we could have a bus go to all these little villages and bring them into a bigger city, into Amman or something like that. Um, Maybe we can give a monthly salary to poor rural Bedouins. Like we could just give them all poor people in these small communities. We could give them money, so that would make it that they could like easily take a taxi or a bus to a doctor if they needed. Um, Alternative D, we could build more clinics in these rural areas because there's not enough clinics there right now. And so we could come up with many, many, many different alternatives. Okay. Um, so when I do this matrix, the Thomas Hatties model, so alternative A, meaning we could pay doctors in rural areas more money. If we compare that to providing free transportation to Bedouins, in my opinion, alternative A is better than alternative B, so it gets a 1. If we can compare paying alternative A with meaning paying doctors more money to work in these areas versus giving a monthly salary to poor rural Bedouins, A, in my opinion, is better than C. And the same thing as we compare A to alternative D. A, in my opinion, is better than D. We just keep working our down the whole way. When we compare alternative B to A, B is worse than A, so it gets a 0. B is better than C, but it's worse than D, so 1 and 0. And then we compare alternative C, meaning give money to all poor rural Bedouins. When we compare it to A, B, and D, it's alternative C is worse than each of those, and so it gets a 0. So, and this is just really, in my opinion. And then D, last thing, it's D is worse than A, but it's better than B, it's better than C, so it gets 2. So when we look at this, the best option would be alternative A, meaning pay doctors more money to work in rural areas, which, if I was just thinking about it, I would probably say that's true. Um, uh, you could do this as a group, like so each person could fill this out, and you could just add them all up. That would be another way to do it. Um, Now, if we want to evaluate the alternatives with the SFF, the suitability, feasibility, flexibility matrix, it would look something like this. I just chose, you can choose any range you want. I chose from 0 to 5, meaning 0, something is not suitable, it is not feasible, it is not flexible. 5, meaning it is very suitable, it is very feasible, it is very flexible. So when I look at uh, our example here, doctors in paying doctors that work in rural areas more money. I think, how suitable is that? Like, is that really like, would that really solve the problem? If you remember the suitability definitions, um, is that ethical? Yeah, it's ethical. Is it practical? Yeah, I think we could pay doctors a little bit more that go in those areas. Is it too extreme? Maybe it's kind of extreme, I guess. Um, but I think it might help. So when we go back to it here, I give it a 3 because it's like I think it could do a pretty good job. Maybe it's not perfect. Feasibility. So do we have the time? Do we have the resources? Do we have the equipment to do that? I thought, I think Jordan could do it. I think it would be hard because it's trying to find more money to give these doctors. It's more money to give them all their equipment and everything. Is it flexible? I thought, yeah, it's very, very flexible. So I give it a 5 for this. I think it's very flexible because at any time you could say, we're stopping this. And we are not going to pay the doctors more money anymore for going to rural areas. Now, when I compared Alternative B, I remind myself, was providing free transportation. Suitability, this is a little subjective, but I thought, I don't think that's really going to solve the problem. Feasibility, do I really think we could send buses and taxis out to all these little Bedouin villages? No, I don't think so. So I gave it a 2. Is it flexible? Yeah, I think we could stop the program at any time if we wanted. So I gave it a 5 for that. Alternative C, which is giving a monthly salary, I thought I don't think they're going to spend the money on getting to primary care doctors anyway. It would cost a lot of money, and I don't think we have that. Flexibility, we could stop it at any time, so that's fine. But for these two, I just scored it really low. For alternative D, which is build more clinics in rural areas, I thought, that might help. Like, if there's no clinics there, they do need clinics, so that might help some. Is it feasible? Yeah. I mean, just to build some buildings, that's not too expensive, and there's workers that could do that. Is it flexible? Like, could I, once we build the buildings and we're halfway through them, can we just stop? You could, but it's a lot harder. Like, you're not going to get any of your money back. Um, so I thought for this one, it's not as flexible. It could, uh, it would be really hard to change your mind once you've already started building the buildings. And so in this model too, alternative A scored the highest. So we finished the alternatives. So now we're going to choose the best alternative and act decisively. So we're going to choose to start paying doctors a higher salary if they are willing to work in rural areas. Um, so now the last thing is evaluation. So we want to monitor and check every month. Are there more doctors that are going to work in rural areas, or did it not make any difference? We also maybe want to monitor the health outcomes of Bedouins in these rural areas. And and then last we talk with the rural Bedouins. Do they feel like this is helping? Do they have any ideas that could help? Okay, so that's my example of working through everything. Now this is your guys' homework, so I want you to you can email me this or send this to me through Microsoft Teams. I want you to write down a situation from your life that you find it hard to make a decision about. It can be anything. It can be uh, it'd be nice if it was something a little bit deeper, like how much time to spend on studying. It can be um, how to, um, hmm, what else? Like, uh, if you want to, um, what college you chose, how much you decided to study for the Taujihi, how you decide on um, what friends you have, like, and who you hang out with, and how you spend your time. Something about uh, just your daily life that it's sometimes it's hard for you to make a decision about. If it's really hard for you to decide on um, what clothes to wear, you can do that. But I think most of you, it's not that hard to make that decision. So this is like a harder decision. What should you buy a car? Something like that. Um, and I want you to write down what was your final decision about the situation and what techniques did you use to reach that decision? And do you think you made the right decision? And what do you think you could have done to improve your ability to make that decision at the time? And then, so this is like a past decision. I want you to reflect on a decision that you've made. The next thing is I want you to um, think of a problem that you need to decide about in the future, whether that's about a car, whether that's about um, uh, marriage, or that's about staying in Jordan versus moving out of Jordan once you graduate, um, what type of doctor you want to become. Um, then I want you to follow the steps that we've outlined. Like go through all of them just like we did in the example. Define the problem, define the objectives, do your research, and then identify the alternatives and evaluate them using both of those matrices that we talked about. And then I want you to just write a quick thing. Did that help you um, in in your decision making ability? Did that help you or not? So go ahead and send that to me within the next week of these two practice cases. And that is it for today.